Welcome. Today is another Proclamation Day, and today I'm very pleased to have a large group of people joining me for Colon Cancer Awareness Month. And in February of 2000, President Clinton officially dedicated March as National Colon Cancer Awareness Month, and since that time it's grown with a lot more people becoming aware, with patients, survivors, caregivers, cancer screeners, and others trying to promote colon cancer prevention, specifically colorectal cancer screenings. So I do have a proclamation that I'd like to read. Whereas colorectal cancer is the second leading cause of cancer deaths in Maryland, the American Cancer Society estimates 2,360 new cases and 860 deaths will have occurred in Maryland in 2015 due to colorectal cancer. And whereas screening is the best method of early detection and prevention of colorectal cancer, and whereas individuals age 50 and over and those under 50 with personal or family risk factors for colorectal cancer should be screened, and whereas the Frederick County Health Department and the Maryland Department of Health and Mental Hygiene urge healthcare providers to recommend colorectal screening for their patients and urge the public to seek screening. Now, therefore, the County Executive of Frederick County, Maryland, myself, proclaims March 2015 as Colorectal Cancer Awareness Month in Frederick County and does commend this observance to all of our citizens. I do want to encourage people to make this part of their regular health care program, to be screened when they're 50 years old or earlier. And you know, while it seems like it is a long process to get this done, I think it's very important so that people can prevent the risk of death from colorectal cancer. If it's caught early, it is a curable disease. This cancer has impacted my family. My grandfather did die of colorectal cancer. I'm personally at a high risk for colorectal cancer. So I did get screenings before I was age 50 and continue to do so. And so it's important to live healthy, to live long, and to really take care of yourself because it is part of preventive medicine and making sure if you have a problem, you can address it as soon as possible. So with those few comments, I'm going to give the proclamation to Beth, and I'm going to ask you to say a few words, and then we'll introduce everybody who's joined us.
Well, thank you, Jan. I'm really pleased to be here this morning, and thank you for being such a champion for screening for colorectal cancer. We have a great showing, as you can see up here today, to observe Colorectal Cancer Awareness Month. We have several members of our Frederick County Cancer Coalition here, as well as the Asian American Center and members from our faith community. So thank you again for this opportunity to be here. I work at the Frederick County Health Department in our cancer screening program. So as Jan said, we just want to get the word out to our county residents about the importance of being screened. For those residents in our county that may lack insurance or be underinsured, please give our program a call. We'll talk with you about how our program works and getting you enrolled. I don't know if I should give our number now or we want to
You
pass
certainly can.
Our
We
phone
can put
number
it on the screen as well.
Okay, great. Our phone number is 301-600-3362. And now I'm going to turn it over to the individual people here to say a little about themselves, but I'd like to start with Kelly over here.
Okay.
Good morning. My name is Kelly Smith, and I'm a member of the Frederick County Cancer Coalition, and I'm also a colon cancer survivor. And like Ms. Garner said, it is very important to get screenings. And although I was not 50 when I was diagnosed with stage 4 colon cancer, I also didn't have a family history for it or any risk factors, but still it happened. So I encourage all of those adults, I would argue 21 years or older, to please get screening, but especially, like you said, if you have a family history for it or any risk factors, which, like I said, I didn't have, but nonetheless, it's very important, and I just want to stress that. Thank you.
Just go ahead and pass it down.
My name is Mark Smith, and I'm Kelly Smith's caregiver and husband.
Good morning. My name is Doris Graham, and I'm here. It's cold out there, everybody, but we're here for a cause, and I'm glad to be here this morning. I'm here from the First Missionary Baptist Church, along with one of my committee members, Mrs. Shirley Hill. We are planning a health fair on April the 11th of this year, and we are inviting all to come. We are glad we're here today because this is a spinoff for what we will be doing on April the 11th. We are going to have some health screening. We're going to have some presenters, and a lot of people, some of the people who are here today will be there on the 11th to help us present our health fair. Reverend William H. Graham is the pastor there, and we are excited about what we are going to do. We are about promoting health for all, and we want to continue that activity throughout the years. We'll be working with Mrs. Chung. And you know, if you're working with Mrs. Chung, you will continue to work. God bless you and thank you.
Good morning. I'm Shirley Hill, and I'm here. Hope you can see my flyer. I'm here assisting Mrs. Graham. We're looking forward to our health fair, and we invite you all once again to please come out on April 11, First Missionary Baptist Church, and be with us. Thank you.
Good morning. My name is Elizabeth Chung for the Asian American Center. It is such an honor to be here among so many, heroes and promoting good health. And we have the health department and also the coalition for the Cancer Coalition, and we have the faith-based, and we also have community members. They are the ones that really do most of the work, all of the work perhaps, in promoting good health for our Frederick County residents. For those in particular, if they have the language barriers, also please call upon us. We'll work with the health department. We'll help you to get down. Also see the doctor, be understood, so don't be afraid. Just get your screening done. And here's my wonderful friend, Mary.
Good morning, everyone. My name is Mary Jackson, and I coordinate the Cancer Education Outreach Program at the Health Department. And my message for you today is screening saves lives, as been indicated here with the audience, the coalition that are here. So I encourage you to participate in your health. I tell everyone in the community that they should be the CEO not only of their body, of their mind, therefore taking care of yourself. If you like the opportunity next year to be part of this great group up here, I invite you to contact us. We're always looking for coalition members, and we're really looking for a representative from our county government.
Okay, all right. I heard that message, Mary. I'm going to pass this down. Thank you.
Gayle Bowerman, a coalition member, and formerly worked with the health department and the screening program. And we can't say it often enough, screening saves lives, and that means you, an individual, and the members of your family have it done, and we can't say it often enough.
Hi, I'm Frank Blanchard with the Frederick National Laboratory for Cancer Research, and as the name says, my organization is involved in cancer research. But really the best way to go is prevention, so I encourage everyone to get screened.
Good morning, Beth Christoffel, Coordinator and Interpreter with the Preventive Health Program at the Health Department.
Hi, my name is Jeannie Canton. I work for Dr. Mark Burns. He's a gastroenterologist who works out of our Urbana location with Capital Digestive Care. So we have formally worked with the health department screening the patients that come in with symptoms, and we've helped them and been able to help patients get taken care of as they present symptoms.
Hi, my name is Jackie Kasto. I'm the administrator at Urbana GI Endoscopy Center. I also represent Dr. Burns and the other three doctors of the center, Dr. Gloger, Witten, and Bender. Early detection is the key, and we've seen some of the patients from the health department and glad we could help out. And thank you all for being here, and thanks for inviting us.
Thank you. Thank you all for being here today. Can someone answer for me if the Affordable Care Act does include coverage for this screening as preventive medicine? Is it one of the things that is covered?
This is a preventative test that is covered by the Affordable Care. In addition, private insurance, Medicare and Medicaid will cover a colonoscopy. So let that not be a drawback or any reason for not having it done. It is covered. It's listed among the preventative screenings that will be covered.
I could add to that.
I would like to put a plug in terms of the healthcare and insurance. Even though we closed, down the enrollment, for the qualified health plan, but we still have the Medicaid all year round. So for those who still need health insurance, please stop by the health department, the community action agency, and our agency. We'd be glad to help you.
Also, if I might add, even though Medicare does cover the cost of a colonoscopy, sometimes Medicare recipients need assistance with out-of-pocket expenses, and that is something our program can help them with. So please, again, call our program, 301-600-3362. Thank you.
All right. Thank you. I appreciate everyone being here today. The strong message is that death and illness from cancer is preventable, and the key is screening. And for anybody who needs financial assistance or is concerned about being underinsured, there is assistance available through the Health Department, the Community Action Agency, and the Asian American Center. So thank you for joining us today. Go out and be healthy.